My name is Nikee Goswami and my team member Jaslene Kaur Delaware, and our topic is the cardiovascular disease. What is the cardiovascular disease? The condition affecting the heart or the blood vessels are collectively called as a cardiovascular disease. Atherosclerosis, a buildup of the fatty deposits of inside the arteries and the high risk of the blood clots are the typically connected with it. Cardiovascular disease caused by the nutrition imbalance. In Western nations like the France, Germany, Belgium, Denmark and the many others, cardiovascular disease is the leading cause mortality accounting for about 30% of the fatalities globally. Additionally, it can be demonstrated that each year 17.3 million individually die. Furthermore, the comorbid conditions like obesity, diabetes, hypertension, which are among the top 10 global risk factors of the mortality, frequently co-worker with the cardiovascular conditions. Blood pressure, stroke, the atherosclerosis, the peripheral arterial disease, and the wine illnesses are the few causes of the cardiovascular disease problem that harm the heart and the blood vessels. Unhealthy eating habits such as consuming too much sodium processed foods, adding sugar, unhealthy fats, and consuming a little fruits, vegetables, whole grains, seafoods, and the legumes. The other linked to the increased risk of the cardiovascular disease. Obesity, smoking, being overweighted, and the absence, stress, lack of activity, cardiovascular disease are the mostly caused by the nutrition which has the potentials to be reversed. Unhealthy diets are linked to and the increased risk of cardiovascular disease. Patterns such as consuming too much sodium and the processed foods, added sugar, unhealthy fats, consuming 2 liter fruits, vegetable, complete grains, seafood, and the legumes. The primary causes of the cardiovascular disease is the nutrition, the which can the repair heart disease. So these are the symptoms: the chest pain, sweating, breathing problems, sometimes darkness in eyes. The prevention of the cardiovascular disease. The U.S. Preventive Service Task Force, the USPSTF, has released the two recommendations on the primary preventions of the cardiovascular disease, and it is the working proposing a third. The first recommendations released in the 2012 covered behavioral counseling on the diet and the physical activity to prevent CVD is individually without the documented the cardiovascular disease risk. The second recommendations released the earlier this year the cover these the use of the vitamins and mineral supplement to prevent cardiovascular disease. A draft of the proposed the third recommendations the which has proposed the public review until earlier June cover behavioral counseling to help the adult with non-CVD risk factor improve the diets and the physical activity. The first recommendations for the preventing cardiovascular disease, the with about the 596,000 the fatalities per year and the age adjust rate of the 191.4 per 100,000 people. Cardiovascular disease the main causes of the mortality in the US. It is generally known that the person who adhere to dietary guidelines and physical activity guidelines have lower risk of cardiovascular disease and the cardiovascular mortality. According to the task force evidence report, a counseling intervention was considered to be low, medium, or high intensity is the lasted between the 1 and the 3rd minutes. Between the 1 and the 3rd 160 minutes or the more than equal, the patient educationally material schedule brief counseling appointment with the primary care providers or doing both. According to the most recent AHA and ACC guidelines on the lifestyle changes, the doctor should advise all people on the making the good eating choice and the engaging in a regular exercise based on the documented advantage of this practice. The authors of the guidelines were aware that the highest risk of the group saw the benefits, but they did not evaluate the data supporting and the behavior therapy as the whole. Second recommendations of the preventing cardiovascular disease. Although the many adults that the vitamins and mineral supplement in the hope that they prevent cancers and the heart disease, the task force most recent recommendations on their use indicate there is the no evidence of the backup theory. Furthermore, there is a strong evidence of the neither vitamin E or not the carotenes. The vitamins prevent illnesses. The U.S. Department of the Health and the Human Service established the Community Preventive Service Task the force of the additional expert panel to give the recommendations of the population's level interventions, the way of enhanced population diet and physical activity. In the widely adopt these community-based theories the while likely to greater increase in the healthy eating exercise level than resources clinical intervention forcing on the certain the low risk patient. The third draft recommendation of the preventing cardiovascular disease. The task force justifications and the advising counseling. The task force does recommendation high intensity behavior counseling for the people who are the overweight or obese, the who also have the cardiovascular factor like the hypertension, hyperlipidemia, glucose level, and the draft on the third recommendation which address those who are the highest risk cardiovascular, providing or the referring patient intensity, the multi-content. The diabetes prevention programs are and the primer packaging of the interventions, the lower blood pressures are the two examples of the behavior intervention that can improve the outcome those who are the risk of the cardiovascular and provide by the task force. Although there is the isn't enough concrete data to support the idea that the counseling and the prevent cardiovascular, the epidemiologic studies show that the among the high risk individually decreases of the cardiovascular rate typically flow the size of the progress the made in the intermediate measures.
Hello everyone, this is Jaslene Kaur Delaware and I'm here to present my peer-reviewed article on CVD. My first article is Diet, Exercise and CVD. This article is based on an ongoing research by US Preventive Service Task Forces for Prevention of Cardiovascular Diseases. This is done by two processes. First, by prescribing multivitamins, and second is by diet and exercise. Counseling was done by task forces and outcomes were recorded. Three types of counseling were done. First, low intensity counseling. This was done on the subject with lower risk of CVD. This was done by clinical practitioners or mailing the patients about the physical exercise and the CVD. Second and third counseling were the medium and high intensity counseling and were done to the patient with obesity or overweight conditions to change diet and start physical activity. In addition to this, monitoring of hyperlipidemia, hypertension, weight management, and other factors such as smoking, consumption of alcohol were also monitored. The Community Preventive Services Task Force was made by US government to help USPSTF in prevention of cardiovascular diseases and other related problems in hope with lowering down the CVD related death in United States. My second article is Hearing Supplemented Diet Influence Risk Factors of CVD in Overweight Subjects. This article is based on studies and relation between fish consumption and CVD. It is seen that fish mussels are more beneficial in reducing the risk of CVD than fish oil or organ if cooked properly. Herring is one of the fatty fish that is deprived of protein but has a very good health benefits in human. The study here was to show diet comparison between chicken, pork and effects on CVD. The subjects selected were between the age group of 24 to 70 years who didn't drink or smoke. They were given herring fish once a day for 5 days a week for 4 weeks. This was cooked to a temperature of 150 degrees centigrade, placed every day in boxes with mashed potato and a little bit of salt. The same way pork and chicken fillet were also cooked and packed and were delivered to the subject. Their weight was monitored along with this experiment. Result showed after blood samples were taken that the diet with herring fish had high level of HDL in body as compared to other diets. The risk factor LDL of CVD was seen to be very low, and so this was positive feedback for herring fish diet. Antioxidant level as well as weight gain was seen slightly in the subject on herring fish diet. My third peer-reviewed article is Nutrition and Reducing CVD. This article is based on the study conducted in United Kingdoms. The death in United Kingdoms are due to CVD and incidence of CVD, CHD, and other diseases that are rising day by day. There are several factors that lead to CVD, such as blood pressure or heart diseases. To reduce this, studies have been done in Finland. Decrease blood pressure, medications, decrease smoking and alcohol consumption, cholesterol, etc. is seen to be successful. There are many strategies to reduce the risk of CVD by diet. First, eat a lot of fruits and vegetables. Include lean meat instead of burgers or pizza. Include folic acid fortified cereals and breads. Restrict high-fat dairy. Decrease alcohol consumption. Include spread with polyunsaturated or monounsaturated fatty acid. Always read the label before buying any food item. Include whole grain or soya products. Eat omega-3 fatty acids. Diet play a very important role in reducing the risk of CVD. There are more than 25% chances by diet alone. Counseling and slowly changing of lifestyle and eating pattern can help a person to reduce CVD, blood pressure, and heart related diseases. Thank you.